This is a really important pattern to recognize. So mild bloating, pelvic fullness, increased urinary frequency, and abdominal pressure are incredibly common during that ovarian stimulation. Again, those ovaries are enlarging, they're taking up more space in that pelvis, and that can be pushing on the bladder. But when it becomes concerning is when those symptoms start to become progressive rather than stable. Rapid weight gain, increasing abdominal distension, severe pain, shortness of breath, nausea, vomiting, decreased urine output, despite maybe some adequate hydrations or even signs of dehydration, immediately raise concern for me that it could be ovarian hyperstimulation syndrome. And then from a bladder standpoint, patients with OHSS may actually report urinary frequency early because of that pressure, but then later develop that decreased urine output. So thinking about the pattern right here is going to be really important. So again, encouraging folks to really look at the entire clinical picture rather than just focusing on just those urinary symptoms on their own. And that bladder often provides a lot of cues on what's actually happening systemically. I would love to see bladder health become more of a routine part of every IVF consultation rather than something that we're discussing only when symptoms develop. So some simple screening questions that a lot of your team members can do in that office could be just recognizing maybe patients that are at higher risk. So screening ahead of time. Do they already have urgency? What does frequency look like? How many times are they going to the bathroom already during the day? Do they have painful bladder symptoms? Do they already have urinary incontinence and leakage? What about constipation and pelvic pain or dyspareunia or prior recurrent urinary tract infections? Those are going to be the folks that really need to stand out, that definitely need some counseling ahead of time, but during the entire IVF process too. We also know that underlying pelvic floor dysfunction isn't just simply compensated for kind of what's going on. And so if they are having pelvic floor dysfunction ahead of time, those symptoms can actually worsen. And we want to be able to isolate those ahead of time and not miss them. And so again, it's that pelvic floor, right? Stress, frequent ultrasounds, injections, enlarged ovaries, altered movement patterns, again, constipation and anxiety all create that pelvic floor muscle guarding. So if they have this ahead of time, now we're going in for these IVF sessions, that's just going to amplify everything. So early referrals to a pelvic floor therapist can be incredibly valuable for that individual. Not necessarily because something's wrong, but we want to focus on prevention. Prevention is a much easier way to help prevent things from happening by sending that referral than treating later on, and our patients deserve better.